Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So tell us about this new, I think it's MIT study, some
Yes.
cough test. It sounds really interesting.
Yeah, so MIT, top engineering school in the United States and maybe even the world, they're using artificial intelligence to characterize exactly how a person with COVID coughs. Remember, we've been saying that COVID is a very different kind of disease. The patients present differently. It's not the flu. It's, and turns out they cough different than people with other diseases. So the MIT folks have come up with a detector to you cough, and if you are coughing and you use this detector, they have figured out how to diagnose whether or not you have COVID or not. It is not a diagnostic test, but if you did get positive on the cough detector by this artificial intelligence, you should then go get a test and confirm it.
All right, we have some viewer questions here. With the continuing rise of new positive cases, will people that already had COVID still need to get the vaccine or a booster shot?
Well, this is another really good question. Probably not everybody, but what we're trying to learn with these vaccines is how much immunity do you need to prevent you from getting sick again? All right. So, right now, there's still only a handful of people who've gotten COVID twice, but that may change in the next 3, 6, 9, 12 months. So there's going to have to be some type of measurement of antibody or T cell function or something to put those people who already had COVID to identify them as at risk, and maybe they should take a vaccine. They shouldn't do it routinely because it could actually be dangerous. So it has to really be studied, but a great question.
All right, next question. I'm currently home with COVID 3 weeks after returning to work in the classroom. My questions are, once I'm recovered, is it still possible for me to bring the virus home to my family via exposure? And if I'm considered a close contact to a confirmed case, will I still have to quarantine?
Yeah, so 2 questions here. So the one is, how long is this person who had COVID contagious? So the CDC has a guideline, and it's basically 7 to 10 days after your symptoms have gone away or the bulk of them have gone away. So the COVID, it starts a couple days before you get symptomatic, then it gets way up level, you're highly contagious, and then really after about a week or so later, it goes way down. So you're no longer contagious. You don't even need a test for that. You just have to, based on your symptoms.
All right, this person says, my mom went to the hospital for emergency surgery. We asked if she was going to get COVID tested before surgery. We were told the hospital only had a certain amount of rapid tests, and when they're gone, they're gone. Yet athletes can get tested daily. Why aren't hospitals getting those rapid tests?
This is really very sad. This is inexcusable. The hospital administrators at that hospital should be fired, period. They can buy this test. They just need to go buy some more. They're for sale.
All right.
And if people want those rapid tests, doctor, I mean, can you really get them quickly if you need to? Where do you recommend people go? A lot of people don't know if you don't have symptoms where you can go.
Yeah, so, the state has all these testing sites. The city has testing sites. The county has testing sites. There are private companies that have testing sites, even a private drive-through site in Lincoln Park that one of my patients found out for me because I couldn't find a place to send her kid to get tested. So there's a lot of places. You've got to look around. We don't have the coordination I can't answer that question specifically, but I know they're out there. You can find them.
All right.
You're going to have to dig.
If you have a question for the doctor, you can go to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Thanks, doctor.
Thanks, doctor.
Great.
Hey, Paul.
Hey.